because your muscles, tendons, and ligaments are used during exercise. And it goes to your central cues, local cues, to your brain, where you can actually perceive what's that exertion when you are exercising. So RPE is defined as a subjective intensity of effort, strain, and discomfort, okay, and or fatigue that is felt during exercise. It is also a subjective correlate of collective physiological responses. So for example, like your heart rate, oxygen consumption, lactic acid. So a lot of people, if they go through very hard training, they will experience very high burnout rates, injuries, and the RPE actually helps to prevent these unpleasant experiences. So as you can see, the factors affecting RPE, they are actually your perceptual or psychological factor, your physiological factor, and your performance factor, which also includes like your mood, your motivation during exercise. Performance could be your time, distance, competition, and physiological, your cardiorespiratory, metabolic, and temperature. These are factors affecting RPE. So we are all familiar with the box scale. So the box scale is 6 to 20, and then it actually accesses the ratings of perceived exertion, and it has identified the training zone 60 to 90% of your heart rate max, which corresponds on 12 to 16 on the box RPE scale. So it's based on the 3-effort continuum, where the responses from an individual under stimulus that includes perception, performance, and physiological. So this is the box scale that we're all familiar with, 6 to 20. With no exertion at all the way to maximal exertion. So the Omni RPE scale, it is a contemporary contraction of a word omnibus, which means it is broadly encompassing all properties, and it's a scale that was developed by Robertson and Dr. Bala, which was developed upon the expectation that a single format could be used for adult males and females. So the usage of the advantages of using the RPE scale, it is a non-invasive and easy tool to monitor and regulate as compared to VO2, heart rate, or blood lactate during exercise. So studies have found that there's no gender differences found in RPE and physiological responses, and there's a high correlation between percent heart rate, percent VO2 max, RPE and percent VO2 max, and RPE heart rate max. And of course, there is as RPE increases, intensity also increases. So in addition, RPE can be a convenient and appropriate tool in regulating suitable physical work intensity exercise programs. Adults can also use it easily to self-regulate the exercise intensity. And from RPE 8 to 10, we want to prevent that because it will prevent harmful cardiovascular incidences, which can occur at RPE 8 to 10. So this study, we have done it before, is the children rate of RPE scale done by Robertson. So some of the kids, we have done studies with children on RPE, and actually student teachers can apply this during their lessons for children and adolescents to self-regulate the exercise intensity during exercise and training. So, and of course, the Omni RPE scale can also be used for adults to exercise within optimal exercise intensity. So if you scan the QR code, it actually goes to the YouTube video that we have actually done for children and for adults. So now moving on to extending it to colors, RPE and colors. So as we have all seen that our RPE scales are commonly utilized during exercise to subjectively estimate the metabolic workload or effort. And it's also a simple and inexpensive way to estimate and self-regulate exercise intensity during exercise testing, exercise prescription, and physical activities. So different colors have association with different states of emotion and individual perceptions regarding their external environment. And actually, visual color perception also affects mood and perceived exertion during exercise. So there was another study that revealed that the lower total mood disturbance and RPE was found during cycling performance when participants were exposed to green color compared to other colors such as gray or red. So colors are also often associated with mood states and emotions. So another study done by Seraphim indicated that RPE responses from the RPE color scale were found to be strongly associated with physiological measures such as heart rate and VO2 among adult women which are R value of 0.69 to 0.78, and it's also strongly correlated to the box RP scale, 0.56 to 0.93. So the rationale of using colors was to potentially allow a more universal application of the Omni-RPE scale across different exercise modalities in substitution of mode-specific pictorial descriptors. So this was the color scale that was done by Toh and Balasekaran with the scale of 0 to 10, extremely easy to extremely hard. So you can see the blue color is where it's extremely easy all the way as the color gradually changes to red zone, which means it's extremely hard. So the RP responses of both gender groups were found to distribute a positive linear function of VO2 and heart rate in the cycle ergometer protocol and treadmill running protocol. So there was a concurrent and construct validity of the scale that established to support the use of the Omni color scale among young adults. So coming to the Omni color face scale, so actually facial expressions have been identified as a tool to communicate emotions, feelings and physical effort using facial muscles. So the use of a facial scale has shown to correlate to RPE and exercise intensity. So this also shows a new perspective of how an observer can use a facial scale to determine exertion level during exercise. So I'm going to show you the scale later on that incorporates color and facial expression on a single scale. So as we saw in the video earlier, we can see that actually there's a rising number of obese and overweight children in technologically advanced countries. So previous research has also shown that RPE is a tool to self-regulate exercise intensity that provides a safe and effective overload stimulus for weight loss and to improve cardiorespiratory fitness. So moving on, the purpose of this study, we actually investigated the effects of self-regulation by utilizing the Omni rate of perceived color face scale on obese students' physiological responses during exercise. So this is part one of the study. So we had students about age 14 years. They underwent an exercise intervention program for 45 minutes for 11 sessions. So they went through a familiarization trial and anchoring orientation during the first session on how to use the Omni RPE color face scale, and they also used heart rate monitors to regulate their heart rate, to measure their heart rate during the exercise intensity. So you can see the picture over there. Figure 1 shows the Omni RPE color face scale, and we actually used the Polar OH1 band sensor to measure their heart rate. So this is a bigger version of the scale. So you can see we tell the students to keep their RPE between 1 to 3 during warm-up, and then during the game time, they keep their RPE between 4 to 6. And of course, we don't want them to be at 8, 9, and 10. We want them to avoid this because this will be risk of sustaining injuries. So this is a familiarization trial and anchoring orientation. The teachers explain to the students how to use the scale. And as you can see in the two videos, the students played a variety of games during the 11 sessions of 45 minutes game. It could be a net barrier game or it could be an invasion game. So as you can see, they are actually playing a modified frisbee game where they are throwing the frisbee and scoring to the goal. So for the first 10 sessions, students did a 5 minutes warm-up, and then they had a 5-minute water break where they record down their heart rate and RPE, and then they had a 35 minutes of gameplay. So the gameplay consisted of a rotation of various net barrier games and invasion games, as I mentioned earlier, for example like kinball, modified frisbee, dodgeball. At the end of the session, the students also recorded their RPE and heart rate again via a Google form. So data analysis, we use FCSS, and then PET test was used to compare the variables, and Pearson correlation was also used to find correlation between variables. So we had a total of 26 students, about 14 years old. Their height about 1.59, the pre and post 1.61 meters. Their pre and post weight was relatively the same, 82.50, and their BMI reduced slightly. So we choose these students that are in the severely obese range, which their BMI is above 30. So as you can see, there is a significant difference between their height, and then which also led to a significant difference between their BMI. So we also can see their warm-up and game RPE and heart rate. There was also a significant difference, and heart rate there's also a significant difference. So their warm-up was about RPE 3, which was good because we asked them to keep their RPE between 1 to 3, and their heart rate is about 123 beats for warm-up, and their game is about 140 beats during the game. And there is a significant correlation between RPE and heart rate. You can see in both graphs for even warm-up RPE, warm-up heart rate, and game RPE and game heart rate. So actually our students, their growth is developing progressively as there was a significant difference between their pre and post height, although there's no significant difference between their pre and post weight. So this may suggest that students may have an increase in lean muscle mass from the exercise. And there's also a significant difference for intensity discrimination among students based on their RPE across all sessions. And there's also a significant linear correlation between their pre-height and their pre-weight, with a R-squared value of 0.789, and then their pre-weight and pre-BMI also R-squared value of 0.722. And their post-weight and post-BMI has a significant correlation also with a R-squared value of 0.711. And of course, their RPE and heart rate warm-up, as I mentioned earlier, there was also significant correlation. And students were able to achieve an average of 67% of their maximum heart rate for the exercise sessions. So they were able to keep within the 60 to 80% of their maximum heart rate. So this coincides with ACSM's guidelines for lactate threshold training or exercise, which is about 60 to 80% of their maximum heart rate. And this also correlates to the students' heart rate and RPE of about 140 beats per minute, and their RPE about 4 during the game. So for the first part of the conclusion, the students are able to self-regulate their exercise intensity using the Omni Color Phase Scale during physical activities. It's also an inexpensive and non-invasive tool for students to use during exercise and physical education lessons. And students are also able to reap cardiovascular benefits and significantly reduce their BMI after 10 weeks of exercise. So coming on to part 2, we continued this in the following year. This time around, we brought the students to NIE, National Institute of Education, where they did their pre and post BIA scan. And then a talk was also conducted by Dr. Bala on body composition that included exercise and nutrition. So to let the students better understand what kind of food they should be eating, healthier options. And then we had, the students' age were also about 14 years old. They went through 45 minutes of exercise for 12 sessions. So this intervention was a continuation from the previous year. The new students that joined, they went through a familiarization trial and anchoring orientation during the first session on how to use the Omni RP color phase scale. So this time around, instead of using the polar heart rate sensors, the students were provided a smartwatch. This was like an incentive. If they finish all the sessions, they could keep the smart brand watch. So this was the formalization trial and anchoring orientation, where the Omni RPE scale was explained to the students how they should use the scale. And you can see on the left side of the video, the students are doing a warm-up. So same thing, they kept their RPE between 1 to 6. And then they played a wide range of games. So the video on the right, you can see they are playing a modified netball. So it keeps them moving and they keep their RPE between 4 to 6. So the same, they did a 5 minutes warm-up, 5 minutes water break, where they recorded their heart rate and RPE for warm-up, and then the 35 minutes of gameplay. And then at the end of the session, the students again recorded their heart rate and RPE. So same thing, their data analysis, we use PET-T test to compare the variables and Pearson's correlation to find correlation between variables. So with a number of students n equals to 19, they were about 14 years old, their height is about 1.61 for the pre, post 1.63 meters, and their weight relatively they kept the same, and then their BMI 33 to 32. So however, we only found significant difference between their height, their pre and post height, but no significant difference for their BMI. So again, these students we selected, their BMI were above 30. So as you can see, however, their warm-up game, their warm-up RPE and game RPE, their P values, a significant difference, and then their warm-up heart rate and game heart rate also there's significant difference. And the correlation between variables, we actually found quite a lot of correlation between like their height, BMI, their weight and BMI, their post weight and BMI as well. So once again, we also found that the students' growth is developing progressively. There's a significant difference between their pre and post height with a p-value of 0.003. 0.003. So, however, there's no significant difference for their weight with a p-value of 0.958. But this may also suggest that the students may have an increase in lean muscle mass from the exercise. So there's also a significant difference for intensity discrimination among students based on their RPE between warm-up and game, p-value of 0.00. So this also suggests that students can discriminate exercise intensity and exercise within their threshold to reduce the risk of sustaining injuries. So there's positive correlation between pre-weight and post-BMI, post-weight and post-BMI with a p-value of less than 0.05. So this indicates that as weight increases, the height and BMI linearly increase. So students were able to maintain an average of, this time around the percentage is a bit lower, 45.77% of their maximum heart rate during the game. However, this needs to be further investigated because the heart rate sensors that we got, they are not as accurate as the polar heart rate sensors. So the readings may be a little bit off. But what we wanted was for the students to actually keep a watch where they can, because the watch could also keep track of their step count and things like that. So to encourage the students to continue exercise even after this intervention is over. So the students, including the new students, were able to self-regulate their exercise intensity using the Omni Color Face Scale during physical activities. So the BIA scan that the students went and did, it was useful information for them, so to work towards a healthier and sustainable body composition. So sports practitioners, PE teachers, physical education teachers, coaches, student athletes can utilize this Omni Color Face Scale during their exercise and training sessions to train within an optimal intensity. So individuals can still improve in their cardiovascular fitness, and this at the same time can help to reduce the risk of sustaining injuries. So we've also published this book on Omni RPE based on the earlier scales. The Omni Color Face Scale is not in the book yet because this was published earlier. So this is the QR code to scan to have a look at the book. Yeah, the curricular guide to health fitness applications in physical education using the Omni Perceived Exertion Scale. And with that, I've come to the end of my presentation. Thank you very much.
Thank you, presentation.
All of you clap hands, please. He is talking from Singapore. Cheo, thanks.
Very good presentation, ma'am. This is a very new topic. It's very interesting also, and it's very useful for the sports person or as a physical educator. We can take it as we can implement in our colleges. Thank you so much, ma'am.
Thank you so much for your attention.
Yeah, ma'am, the new technology is saving the lives. As we already know that how smartwatches are helping the elderly people from the cardiac arrest like that. So these watches, these bands also will improve the progress in the Department of Physical Education or else in the sports. It's a very nice new innovation in the sports. Thank you, ma'am, for your nice presentation.
Okay, thanks, Cheo.
Thank you. Thank you so much. Thank you.
Thank you, Cheo. The next presenter is, we are having 3 more presentations, short presentation. I request all the speakers, please do short. We have to go for closing ceremony. Meenakshi Madam is there, Dr. Shankar Rao is there on patents, then Super Power Yoga last session will be there. Then we are going to close. Meenakshi Madam, please come.